health misinformation. Since then, we have continued to emphasize what individuals can do to stop health misinformation in its tracks. That includes asking everyone to raise their own bar for sharing health information by checking to make sure that it's backed by credible scientific sources. As we say in the advisory, if you are not sure, don't share. And we'll continue to say that on social media, in a video PSA that we've created and released, and in conversations we're convening with people around the country. We're also mobilizing other stakeholders to address misinformation, from technology companies and healthcare professionals to researchers and community-based organizations. In fact, right after this briefing, my office will be hosting a conversation with community organizations around the country to discuss the steps that they can take to stop the spread of health misinformation. Here's the bottom line. Misinformation is a threat to our health, and the speed, scale, and sophistication with which it is spreading is unprecedented. I will not hesitate to say that and to call for greater accountability and action to address health misinformation. A word about equity, though. We recognize that equity must be at the center of our work to confront health misinformation. And here's why. Because unequal access to the healthcare system, education, and technology means that some people have more limited access to accurate information than others. And when those people instead encounter health misinformation, it can worsen their health outcomes, which exacerbates health inequities in what becomes a vicious cycle. Ultimately, while the threat of the Delta variant is here, while climbing infection rates are what we're seeing day to day, primarily among the unvaccinated, it is more important than ever before that we not let our guard down. And that's why I'm asking everyone to please talk to your family and friends about getting vaccinated, because you could be saving their life. That's the people power movement that we've got to expand in our country. We've made great progress thanks to the hard work of millions of people across this country. We should not forget that, and we should be proud of it. But we have more work to do to end this pandemic. I look forward to taking some of your questions, and I'll turn it back to you, Jeff.
Thanks, Doctor. And let's open it up for a few questions. I believe we're having trouble hearing the questions if the questions have begun. Okay, we're taking a minute to sort through this technical issue.
Hello.
Okay, we can hear.
Okay, great. Thank you. This question's for Dr. Walensky. Last night, President Biden indicated that the vaccine may be approved for children under 12 as soon as August, September, or October. Is there anything you can share about what led to that time frame and what any preliminary data shows so far for children who are participating in clinical trials? And one more quick thing on this. Do you anticipate approval will be for all children under 12 at once or likely be separated by age groups?
So maybe I'll just say that we're looking at the clinical trial data now. We're waiting for the clinical trial data to come in. The approval of the data and the authorization will be a regulatory FDA decision. So after we have seen the clinical trial data, I have not seen them myself. After we will see them, then they will go to the FDA for their regulatory process of authorization.
Dr. Fauci, anything to add there? We're having trouble hearing Dr. Fauci.
I'm sorry, Jeff, we were on mute. No, just to underscore what Dr. Walensky said, and that is that the clinical trials that are in progress are doing an age de-escalation. That relates to the second part of the question is question. So they'll do 12 to 9 years old, 9 to 6, 6 to 2, and then 6 months to 2 years. The data are being collected right now. Ultimately, as Dr. Walensky correctly said, This will be a regulatory decision based on the data that's accumulated.
And I'll just reiterate what we've talked about before, which is the FDA is the gold standard for vaccine review and approval. They'll run an independent and rigorous scientific process, and when that process is complete, the American people can rest assured that the FDA maintained those world-class standards throughout this period. Next question.
Let's try Sabrina again.
Okay, great. Just want to make sure that you can hear me.
Yes.
All right, thank you so much.
Thank you.
Perhaps it's a question for Dr. Fauci, who talked about how effective the vaccines are at preventing severe illness. I'm curious if we know more about what the risk of breakthrough cases resulting in long COVID is, and given how recently people have been vaccinated, how long might it take to start identifying trends among possible long-haul patients who've been vaccinated?
Well, that's an object of a very intensive study right now, following individuals with various levels of seriousness of disease as to what the incidence and prevalence will be of long COVID. We don't have enough information right now to give you an accurate number of what that incidence is, but that's something that is being very actively followed right now.
Next question.
Elizabeth Wise at USA Today.
Great, thanks so much for taking my call. This is a question for Dr. Walensky. I've been talking to epidemiologists, and one of their concerns is that the CDC's masking policy lacked teeth, so most people just took it to mean they didn't need to wear a mask at all. San Francisco is now contemplating requiring proof of vaccination to get into bars and restaurants. Other people have suggested that masking regulations change if cases go above 5 per 100,000. Are there any thoughts in the works of either clarifying or changing CDC's masking policy?
Thank you, Elizabeth. As we have said consistently, the greatest risk right now is to those who are unvaccinated. And we have consistently and repeatedly said, if you are unvaccinated, you need to be wearing a mask to protect yourself and others around you. And we need more people to get vaccinated to stop this pandemic. So overall, the CDC recommendations haven't changed. Fully vaccinated people are protected from severe illness. And we've always said that communities and individuals need to make the decisions that are right for them based on what's going on in their local areas. So if you're in an area that has a high case rate and low rates of vaccination where Delta cases are rising, you should certainly be wearing a mask if you are unvaccinated. If you are vaccinated, you get exceptional protection from the vaccines, but you have the opportunity to make the personal choice to add extra layers of protection if you so choose.
Next question.
Michael Shear, New York Times.
Hi, can you hear me?
Yes.
Okay, thanks. This is for Jeff, probably. One specific and one general question. The specific question is there was this report overnight about the White House discussing masks, discussing mask mandates in light of LA County's decision and the rise of the Delta variant. Can you tell us whether that report is correct? Is the White House, in fact, having high-level discussions about that? And then on a broader level, I wonder if you could sort of reflect on the moment that we're in compared to where we were just two or so weeks ago, when the president welcomed sort of the world back to normal with the 4th of July party on the White House lawn, and it felt like we were going in a very different direction. How the president said yesterday he was frustrated by all of this. How much of a different place are we in, and what does all this portend for everybody going back to school and work in the fall?
So on masking, I think you just heard a very strong summary from Dr. Walensky, and that's where we are. We will follow the science, and public health guidance is made by Dr. Walensky and her team at the CDC. So we will continue to follow the science and follow CDC on mask guidance or mask recommendations. I think the president captured it well last night, and it's consistent with his message on July 4th. We've made significant progress with 162 million people fully vaccinated, and fully vaccinated people have a high degree of protection, even against the more transmissible Delta variant. If you are not vaccinated, as the President spoke to unvaccinated people last night and back on July 4th, you need to get vaccinated, or you do not have a high degree of protection for yourself, for your friends, and for your family and your community. So, we've made significant progress. We're in a very different place than we were several months ago by getting 162 million people vaccinated, but we have a lot more work to do, and unvaccinated people need to roll up their sleeve as soon as possible and begin their vaccination routine. Next question.
Time for a couple more questions. Let's go to Caitlin, CNN.
Thanks so much. Dr. Walensky, I just want to circle back on this just so we have complete clarity. Is the CDC considering right now changing its mask guidance for people who are fully vaccinated?
We are always looking at the data as the data come in. Our guidance has been clear since we put it out several months ago, and that is if you are unvaccinated, you should continue to wear a mask and protect yourself against others around you. And more importantly, you should go and get vaccinated to get better layers of protection. We have always said that local communities have to look at what is going on locally as we have very heterogeneous country right now. In areas that have a high amount of disease and low amounts of vaccination, that, if you're unvaccinated, you should absolutely be wearing a mask. If you're vaccinated, you have exceptional levels of protection from that vaccine, and you may choose to add an extra layer of protection by putting on your mask, and that's a very individual choice. That has been consistent with our CDC guidance since we put it out.
Why don't we do one more question, please?
Let's go to Tamara Keith at NPR.
Thank you so much for taking my question. It's two questions, but I'll make it quick. A lot of people who've gotten the J&J vaccine are wondering if they can or should get an mRNA booster. I know it's not recommended at this time, but are you recommending against it, or should patients and their doctors make a decision about that? Also, wanted to get an update. In early June, you announced a plan to share 80 million doses globally by the end of June. It's middle of late July. What has stopped you from meeting that goal?
Okay, why don't we start with the J&J vaccine booster question, Dr. Fauci.
Yes, thank you, Jeff. The J&J vaccine, the data that I showed on the efficacy slide was one of the slides I showed, is a very effective vaccine. There is no reason to believe right now that people who have taken the J&J vaccine are in need of a booster dose of any sort. There are no data to indicate that that is the case. Back to you, Jeff.
On the global front, as you know, the President is committed to sharing 580 million doses of vaccine to the world, 500 million doses of Pfizer being donated to those 100 or so countries most in need. This is by far the largest ever donation of COVID-19 vaccines by a single country. We shared the 80 million by the end of June, and they have now shipped. So they have, they're in the air or they've arrived in the recipient country, and will continue to share tens of millions of doses across the summer months beyond the 80 million. Thank you for joining, and we look forward to seeing everybody at the next briefing.